All right, so let's get into rest and recovery tips for healing. So let's back up a little bit and talk about before giving birth. So, what are some things you can do before having the baby to possibly set yourself up for better healing? So, one of the things that is talked about is perineal massage. Some people do this. I think it's recommended starting around 32 weeks on. And basically, what it is kind of warming up that vaginal perineal area for the stretching that's going to occur with a vaginal birth. So people do this ahead of time to try to decrease the likelihood that they will tear or that they will need an episiotomy. So Young Living Essential Oils has a spray called Clariderm. And so a lot of people recommend that for this, but I think you can use coconut oil, olive oil, or whatever massage oil you want to use, as long as it's okay to be internal, because some of it's going to get like into your vagina. So you can use your fingers or your thumb to massage the opening to your vagina towards your perineum and kind of work the area to stretch it, make the skin more pliable, so that when you give birth, you possibly will have a less likelihood of tearing. I know people personally who swear by this. I did it for my second baby and I still tore the same. I tore the same for all three of my babies, and I did the perineal massage for the second one. And for me, I didn't notice much, but maybe I didn't do it right. I just wanted to present this as an option because some people do swear by it. Body butter or lotion on the belly. So pretty much almost everyone, I feel like, does some kind of lotion on their belly throughout pregnancy because they hear that maybe it can prevent stretch marks. So it's not exactly proven that this would be the case, that you can prevent stretch marks with this, but it's worth a shot and it can't hurt, because as your belly stretches, the skin itself can get itchy because like it's stretching and getting a little drier, and the moisture of lotion can be good in itself, but also the act of massaging the skin can possibly help the plasticity of the skin and maybe could lead to decreased stretch marks happening. I got stretch marks with my first baby, but not until the very last week, and I ended up being 4 days overdue. So I know also plenty of people who ended up with 0 stretch marks. I'm just not one of them. And then exercise beforehand. So I saw a chiropractor before I gave birth. I highly recommend it during pregnancy. But one of the things that they recommended was pelvic rotations, like hip rotations. So I used one of those big blow up yoga balls and would do 2 minutes of rotating one direction, 2 minutes the other direction, and then pelvic tilts side to side and then back and forth. I have a video of this on my exercise section here. It's supposed to, keep your joints and ligaments loose. It's supposed to help keep your pelvic floor muscles engaged. They're supporting your baby. So I think it's worth a shot. If you do yoga during pregnancy, which there's plenty of prenatal yoga online classes, in-person classes, my one recommendation with prenatal yoga is that you don't stretch too far. Stretching your body too far, because you may find that during pregnancy it's easier to do some of these bends and stretches, which seems counterintuitive because of the big belly, but because of the hormone relaxin, you might feel that some of your joints are actually more bendable, and that can be true, but if you bend them too far, you can actually cause some injury. So just be a little bit careful. Don't be a super yogi person during pregnancy. Okay. So what just went down? So once you've had the baby, what just went down? A human or more than one exited your body. So there's a lot of healing that needs to be done. Healing needs to be done both internally and externally. All of your organs that were just pushed around now don't have this big object in there pushing them around. So they need to go back to where they were, including your uterus. So your uterus was stretched quite large, and now it shrinks back down to its original size, which is about the size of a pear, and even like the shape of like an upside down pear is what your uterus will shrink back down to. So if you think about it, it's kind of like the size of your fist. And it does a lot of that shrinking in the first couple days. And we'll talk about this more when you're breastfeeding, but it can be quite uncomfortable, like the cramps that come along with your uterus shrinking back down. And then the external healing, either tearing, episiotomy, or if you have an incision from a cesarean. Lots of healing to be done. So let's talk about the tearing. For a vaginal birth, there are 4 degrees of tearing. The first is just kind of more of a superficial skin tear. So you might not even need stitches for this, and it shouldn't be too painful, just might sting a little bit when you pee. Second degree, that's what I had with all of my kids, perineal skin and muscle tear. So it goes to the level of the muscle. You likely need stitches. You will need stitches for this, and it comes with a little bit more pain, but it's, reasonable. It's pretty common. It's the most common level of tearing. Third degree, that extends to the muscle around your anus. You may even need to go have surgery in the operating room to repair this. And then the fourth degree, it extends basically connecting those holes down there. So it extends to the lining of the rectum, and you will likely need operating room repair. And so along with that comes extended time frames of healing. So just if you know that you had a 3rd or 4th degree tear, don't compare yourself to people who have lesser tears. You will need more healing time after this. So what is an episiotomy? So it depends on the situation. Some doctors don't do them. Some doctors prefer them. I would talk to your OB about what their practices are, but under certain circumstances, episiotomies still happen. And it's just it's basically like if the baby gets stuck, sometimes they'll do just a little snip to let the baby out. And that's at the vaginal opening. And they usually just require a couple stitches. So the healing from that is probably similar to tearing, like a minor tear. And then, of course, a cesarean abdominal incision. It can be vertical or horizontal. Most of the time, it's down by the bikini line, horizontal. But it does require 2 cuts. So you cut from the outside, but then you also need to move the organs aside or pull them out, some of them out, and then cut again to get to the uterus. So this is pretty major surgery that happens very quickly. So, and then they put everything back together and zip it back up. And it's a lot of healing time. You usually have an extra day in the hospital, and then usually an extra couple weeks is expected of healing. So C-section moms, especially unplanned C-sections, are basically healing in both areas. They're healing at their incision site, and they're also healing down there where they would have delivered vaginally, because if you were in labor for a long time, you still had all the same stretching and moving about of those lower pelvic muscles, and you basically have the worst of both worlds. So give yourself a lot of grace if you're one of those moms who had a long labor that ended in a C-section. So when you are at the hospital, they will provide you with all the supplies that you need for your immediate healing. So you need to take full advantage of this. Use all of their supplies, and then stash some in your bag and take as much as you can or as much as you want to when you leave, so that you go home with a little bit of a stash. And then anything else that you need beyond that, you can order yourself more. But the things you're definitely going to want to take home are this Peri bottle, which is a little squeeze bottle that you can put water in. And that's what you use instead of wiping with toilet paper. You're going to use this bottle to clean yourself off after peeing and going BM. And then you'll use a little toilet paper as needed. The mesh undies, they're like these stretchy, disposable underwears that like hold in the pads when you first give birth. You've probably seen pictures of people in them. And then they have these really large, I'll show you a picture, these really large diaper pads. There they are, that middle picture. They open up, like that's them folded in half, and they open up and you put them inside the mesh undies. And then on the left, you can see the tucks pads, and those are witch hazel pads. They're little disposable. They look like makeup remover pads kind of, but they have witch hazel in them, which is a healing herb. And you put them on the pad in the mesh undies. And then on the right is this pain spray that you can use. There's probably different varieties, but so every time you go to the bathroom at the hospital, it's a whole production because you're using the peri bottle to spray away a lot of the blood that's happening. And then you're cleaning yourself up and setting yourself up with your pad and everything. And then if you're a C-section mom, you are still going to be experiencing the bleeding, or at least some of it, as vaginal birth moms are. So, and also the pee pads. So they have these like big pee pads that you can fold out. They're the ones that sit under you on the hospital bed. And you can take some of those home. And I have a little video that I posted on here about how to make your own pads at home for when the ones you brought home run out. Okay. So yeah, so here on the left is like the folded up pee pad. And then those at the top left picture are just regular pads that I bought on Amazon. Okay. In the middle is the Tux brand pads, and on the right there's two different kinds of spray that you can use. So once you're home, use up the hospital supplies you have, figure out what you need. And then I went on Amazon and ordered pads and stuff because I didn't feel like going to the store and buying all that stuff. And you can find Tux and ice packs on there as well. Because, at the hospital too, they usually have like long ice packs that you can put in your undies. And if you need it for pain relief, they can be an absolute lifesaver. With my first birth, I was addicted to them. They helped so much because I was in a lot of pain, and then I didn't need them for my second two births. So you may want them, you may not. So once you're home, these are other tips for healing. So this picture here, it's called a sitz bath. So what it is like you put warm water in it and you kind of sit in it, and it can help with your healing. And you can even add like herbs to it, witch hazel. And if you want to look up what other people do, I never used it, but I do know that it's recommended, and it's kind of it can be like an ancestral method of healing that I've seen in some books too. So ice packs, like I just talked about, you can buy them and you can also make them. So some people, what they do is they'll make like a tea with witch hazel and other healing herbs, pour the water onto a regular maxi pad and freeze that, and then use them. And then Clariderm is that Young Living spray. So C-section, I just want to touch on this real quick because I don't want C-section moms to feel left out. They are obviously healing from serious surgery. And so the healing for them is probably harder than vaginal healing, but it's just not my experience. So it's not what I can speak to from first person stance, but here we go. So I have some things. Bio oil I've heard a lot about. That can be something that you rub into the incision, but you have to wait till it heals first. So you have to wait several weeks for that. As with any scar, you're supposed to resist the urge to scratch because that can affect the healing and affect how it looks afterwards. They do have this special high-waisted underwear that I recommend you get because all the C-section moms I know have said that it really helps to just feel like, especially after you take the bandage off, to feel more supported by like a higher waisted underwear. So with your C-section scar, make sure you see a doctor, or at least call them. You can send them pictures, usually on a portal too. If you have redness, increased bleeding from the site, increased pain, discharge from the site, or a fever of 100.4 or more. And you really aren't supposed to lift anything heavier than your baby. That kind of goes for all brand new moms, but especially C-section moms, you're not supposed to lift up like if you have older kids or anything heavy. I know that's easier said than done. So belly bands, this is another like ancestral practice that's really common in some cultures. There's different names for them: belly bands, belly binders, belly belts, I think. Belly binding has been used to help internal organs and musculature go back to where it was, thus accelerating healing. So it's recommended you can do it for C-section moms can do it, but they have to, I think, wait till their incision is pretty healed. But vaginal birth moms can do it even right away. But you just want to be careful about how tight you're doing it, how long you're wearing it for. It can be counterproductive if it's so tight that you're kind of like bearing against it and you're kind of creating this intra-abdominal pressure. But a lot of people swear by it because it can kind of act as like a butterfly bandage for your torso, especially if you have diastasis, which we'll talk about, which is the separation of abdominal muscles. It can help just kind of hold things back in place to make it easier for things to go back to where they're supposed to be. The brand I have is the original Belly Bandit. Honestly, I was not good about wearing it. I wore it a few times this pregnancy and I just like wouldn't think about it, or I'd be laying on the couch a lot and didn't really want to wear it while I was laying down. So just wanted to let you all know about it, but I don't have too much experience with it. Something I want to talk about is this self-body shaming that we all have done in the past, but I wanted to stop now. You will heal at your own pace. You know, this is just easier said than done, I know, but like, please don't compare yourself to others. Your body just did the most incredible thing a body can do. One of the biggest transformations a body can make, right? I want you to try to love yourself the way you would encourage a friend who is healing from the same thing. You would never tell a friend like, hey, get that body back. Hey, what are you still doing on the couch? No, this is bigger than us, right? And worrying so much about what our belly looks like right now, it's just not the most important thing. It's just really not. We have more to focus on. And I just would really encourage you to take that focus away from your looks, from the sight of your belly right now, and appreciate your body for the miracle that it is. So next up, we're going to talk more about pelvic floor rehab, but I want to let you know that healing is coming, okay? It may seem like you will never be the same again, and in some ways you might not be, but there are things that you can control regarding your healing timeline. And once you do those things, you must give yourself grace because there's only so much you can control. I just want to reiterate this. You made another human. You made another human. You made another human. You, my friend, are amazing. I will see you in the next part of the module.